Well, here is something I never thought I would say. Ready? I have eliminated drains from most of my deep plane facelift, deep neck lift operations. If you have watched my videos over the last few years, you know that I used to rely on them and thought they were incredibly important, and I still do in certain contexts. We're going to come back to that at the end of the video. And you've seen my patients with their drains in. I've probably scared you. You probably looked at those patients with their drains in and said, if it weren't for that, man, I could have that operation. Well, now's your chance. So why the change? First, let's talk about where we use drains and why they're important. Anytime we separate tissue layers, for the first several days until those layers readhere, there is an opportunity for fluid to collect. I want you to think of that kind of like a blister. The top layer of the skin separates from the next layer and fluid accumulates in the middle. Traditionally, when we do deep plane facelifts, we free up the skin in this entire area demonstrated in yellow, and then we make an incision into the deep plane at the red line from the corner of the eye down to the corner of the jaw and then following along this neck muscle, and enter the deep plane to free up the entire rest of the face, shift everything back with no tension, set it in, trim away the excess skin. Well, that entire yellow area is just like the inside of that blister. It has the opportunity to accumulate fluid, and that's what the drains prevent. In tiny baby little mini lifts where very little skin is elevated, you don't really need drains because there's not a huge opportunity. The surface area is so small. Of course, those tiny little baby mini lifts, they don't do very much in the front section of the face either. Now, what if we could have our cake and eat it too? Decrease the amount of skin elevation so the area for fluid to accumulate is minimal, but still get mobilization all the way down the front of the face. Well, as it turns out, if you elevate more of the face in that deep plane, enter the deep plane earlier, the amount of area that's under the skin where fluid could accumulate is really small. It's kind of like a mini lift, but the entire face is truly mobilized in that deeper plane. That deeper plane is very resistant to fluid accumulation, so you can have your face and eat it too. You can have your cake and eat it too. So in the upper face, we have recently been pushing the transition into the deep plane. Instead of entering at the red line from the corner of the eye to the corner of the jaw, we're pushing it further forward towards the blue line. My good friend Ben Tele in Los Angeles has been a big proponent of this. We can't push it any further back, however, because the yellow line represents the temporal branch of the facial nerve. That's the nerve that moves your eyebrows, and so we can't push it any further back. But even pushing it somewhat further back decreases the amount of skin elevation, the amount of dead space. My good friend Mario Saravolo in Rome has for a long time talked about not undermining all of the neck skin and doing what's called the lateral skin displacement platysmoplasty. Well, I've taken his concept and pushed it even further so that we now enter the platysma where it first starts, instead of kind of halfway up the platysma like he's been doing, right where it first starts. And now I'm only undermining the skin in this little green area, entering the deep plane early in the face and way lateral on the neck as far possible where it first exists. And then all of the purple area is actually thoroughly mobilized. It's a comprehensive, really well done, fully released deep plane extended lift. But by the time we then inset it, trim everything away, the amount of resultant dead space, the little bits of skin that are undermined and still have opportunities for fluid to collect, are negligible. There's a tiny little pocket in front of the ear, a tiny pocket behind the ear, and an isolated, not connected, small pocket under the chin that allows me to do the deep neck work. Having these three pockets, isolated, non-connected, and really small, very low chance of fluid accumulation. So low, in fact, that I trust fibrin glue. Fibrin glue is something that I used to use 20 years ago. As we got to these bigger skin flaps, I got away from it because I felt the drains were necessary. Now that these pockets are so small, I've gone back to it. And what we do is in those little residual dead space pockets, we spray it in. You can think of it almost like biological rubber cement. It seals those tiny pockets shut. They're so small, they're very unlikely to accumulate fluid. And even if one of them did, since they're not connected to each other, it's very easily managed. So with that, with my deep plane extended facelifts and deep neck lifts, I have gotten away from drains. A couple side benefits. One, by not separating the skin from the platysma in this whole region, we have better control of the skin of the lower neck and upper chest. And again, Ben talks about that, and he is right. Mario Pelle really pushed that quite far, and he is right, and it's benefited me to take both of those into account. The second thing that has actually been of benefit is the more we lift up the skin layer, the more bruising and swelling we get. The more we can avoid lifting up the skin layer, the faster people tend to look better. So if you think back to Kevin very recently, and Marion, my 77-year-old, and my recent 70-year-old Becky, they all healed really quickly compared to what they would have, and that's because they were all done with this new drainless technique. It's not the absence of drains that's making them heal more quickly. It's this different style of dissection that both speeds recovery and decrease the need for drains. There are two conditions though where I do think drains are still important. When I'm doing an isolated neck lift, I'm not making incisions around the ear, and I need the neck skin to redistribute. In that context, I do undermine the neck skin more broadly again to shift and control all the excess. And in that context, I still like drains, usually about 5 days. The second context is brow lifts. When we do a brow lift, little bits of fluid, blood and fluid, can accumulate underneath the brow. And if that's not evacuated, it collects underneath the eye as a black eye. So for the brow lift, I leave the drain in overnight, and it dramatically decreases the risk of a black eye. So brow lifts and isolated neck lifts, I still use drains 5 days here, 1 day here. But if I'm doing a face neck lift together for the current time, I've been away from drains for a while. My patients are doing really, really well. And I want to make a point, it's not because of public opinion or because we were wrong about why we're using them in the first place. With big flaps, I want them. It's because the technique has changed, or we can have our cake and eat it too.